Good morning, nurses. Today I wanted to talk about arterial lines or pressure lines in general. All pressure lines have similarities except for the one for the ventriculostomy. That's its own separate kind of pressure line. So arterial lines, Swan-Ganz catheters all have a lot of similarities. They all have a bag of normal saline, usually a 500 ml bag, and it's in a pressure bag pumped up to 500 millimeters of mercury. That allows for about 3 mLs an hour of fluid to be infused into the vessel. And then if you have from the pressure bag, follow it along, you have squishy tubing like IV tubing. It has some give. And then you have a transducer, which is a rectangular little plastic box. And that's what turns our pressures into a waveform that we can actually measure on the monitor. And the transducer area has a little cap and a stopcock. And then it has some hard tubing where you squeeze it and it's really, really hard. There's no give. And that tubing is to the patient. And then it attaches to the patient. And then somewhere along the way, there's a little port that you can draw blood from. So what are some important things about pressure lines? Okay, other than having the bag pumped up to 300 millimeters of mercury, there's also a green line that shows on the little air gauge to let you know that you're in the right place. You also need to have the transducer at the right level of the heart or the right atrium, which is the fourth intercostal mid-axillary space, and that's called the phlebostatic axis, and that is the level that you want to have your transducer at for accuracy. Too high or too low, your blood pressure won't be accurate. Other things, you have to zero your line if you think there's anything wrong with it, when you're troubleshooting, when you're first hooking it up, and at the beginning of your shift. All of those times you want to zero it and make sure that the atmospheric pressure is kind of ignored. So just like when you put something on a scale and you have a tare weight where you make it 0 and you say this plate is 0, ignore the plate, only weigh what's on top of the plate. Same thing with the pressure tubing. You open it to air, the transducer to air, and you tell it ignore all of this atmospheric pressure pushing on us around and only measure the pressure inside the patient. So you have to turn the stopcock off to the patient. So you're going to turn it off to the hard tubing. You're going to feel which side has the hard tubing, turn it off to that, take the cap off, hit 0 on your monitor, and then once it says 0, then you can put your cap back on and turn your stopcock back off to the little port, and you should be good to go with your blood pressure. Or your PA pressure or your CVP, whatever kind of line that you're using, they all work the same with the transducer and the pressure bag and the hard and squishy tubing. So hopefully that helps, gives you a little insight. I know it would be better if I had the actual tubing in my hands, and I should do a video like that sometime in the near future. And remember to go to my YouTube. I've got lots of videos on there, and like, share, and subscribe, and I'll see you later.